I'm Yervand Hakobyan, President of Armenian Hematology Association. Armenian Hematology Association, member of CLAN. CLL is the most common blood cancer disease in the world, and well known that CLL patient immune system every time affected. That's a great problem, the CLL patients, because it don't depend which stage we have in patient with CLL. Every time we have a big impact of immune system, and we have a problem and with innate immune system and adaptive immune system. That's why the great problem, the doctors and patients, as well the patient caregivers, to keep the patient as possible, as far different kind of infection. Big challenge for the patients with CLL and doctors who treated these patients, the COVID pandemic, because the many research and studies show us that COVID have a big impact in CLL patients, and many articles showing that especially more affected the patient who already received the treatment. And with this patient, we have a more morbidity and mortality rates. That's why it's very important, and COVID become the big lesson or big experience for us. Is a little bit hard experience, but we should got from these lessons many important things for future, to understand how we can go with the cancer patients, especially with CLL patients who have a big problem with immune system, to keep treatment or discontinue treatment, or how to go with the first time diagnosis patient in this kind of situation. In my opinion, even we haven't any restriction, the doctors, patients, and caregivers should keep the regular and life-saving rules. I am repeating, but hand washing, keeping the distance, wearing the mask is very important. And it does not depend we are in pandemic situation or in regular life situation. We should keep this kind of rules. And another experience and lesson from this pandemic, that sometimes public health hospitals should be very active and fast thinking to understand the situation, and changing some not so hard things, even how we can keep the patient at the rooms and receive the treatment not in hospitals, but changing the treatment schemes to continue treatment, but at the same time keep the patient from the infection and the risk to catch some kind of infection. It can be COVID or other infections. And let me, in CLL World Day, send my message to society. Remember about patients who have the immune compromised situation, and your acting and caring can save the life of this kind of patient.